Welcome to Real Hope, a monthly video series by the Mississippi Department of Mental Health to share more about specific services and supports that are available in our state to help our friends, family members, and neighbors who have a mental illness, substance use disorder, or intellectual or developmental disability. Each month in our Real Hope series, we will dive a little deeper into a specific service or support.
This month in our Real Hope series, we're highlighting the successes and impacts of the Suicide Crisis Lifeline, as July marks the third anniversary since the launch of 988. Back in 2022, 988 officially launched nationwide, making it easier than ever for people to reach out during a mental health or substance use crisis. Before then, people had to dial the full 10-digit number for the National Suicide Prevention Lifeline. Now, just 3 simple numbers, 988, connect you directly to trained counselors anytime, day or night. For Mississippi, this has meant a game-changing boost for mental health support statewide. The National Suicide Prevention Lifeline sourced over 9,000 calls to Mississippi in fiscal year 21. Since the 988 rollout, the state has seen a 14% increase in annual contacts, proof of growing awareness and trust in the service.
All callers are important, so what you're struggling with right now is important. This is something that you're dealing with, so just let's talk about it and see how we can help. Because you do have some calls that say, well, it's not very important what I'm dealing with. I think everything that a person is dealing with is important because they're struggling with this, so it is a crisis to them. Even if it is just loneliness and they just need to talk and vent, to talk about their day, all callers are important.
Mississippi's 2 Lifeline call centers now consistently answer over 97% of calls, among the highest in the nation, ensuring our people receive timely, compassionate support. And that's not all. Geo-routing, which launched in September of 2024, routes callers based on GPS-detected location to local crisis centers, enhancing response speed and relevance while still fully respecting privacy.
So if someone calls 988, what they will hear is going to go to the main 988 national office, and there will be a recording basically stating that they're going to be routing the call to the closest center, and then that's when it will be rolled over here. During that conversation, it might say your call may be recorded, and just so people will know, we do not record our calls. We do not record our calls. They are anonymous. The person does not need to give their name or number or their location.
Since 988 started, Mississippi's 14 mobile crisis teams have made over 2,100 visits in 2023 and more than 2,700 visits in 2024. These mobile teams typically respond within 1 to 2 hours in our urban and rural communities, covering more than half our residents, with over 51% residing in rural areas. Many of these visits came from 988 calls, showing that the Lifeline doesn't just provide someone to talk to, it connects people to real in-person help when they need it most.
Over 80% of the calls to 988 are managed and handled within the call itself. Less than 20% go even beyond the call itself. That is where we try to engage our mobile crisis teams. And at that particular point, that's where they're going to interact with the caller or the chat visitor in order to keep them safe and make a plan. If there's a need for face-to-face, even then it's only if they feel like there is a need for law enforcement to even be involved at all.
This anniversary, we're highlighting how 988 isn't just a number. It's a part of a lifeline woven into our Mississippi communities, where we strive to have accessible, trusted, and grounded resources in local care. If you or someone you care about is struggling, call or text 988 or visit 988lifeline.org to chat today. You matter.
By making more people aware of the resources available in Mississippi, we can ensure that more stories of resiliency and recovery are created each day.